Hi everyone. In today's clip, I will talk a little bit about hepatitis B. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, hepatitis B is a virus, HBV, that infects the liver. It spreads through blood, like needles, transfusion, sexual contact, or even from mother to baby, and it can be either acute, which is short-term and may resolve, or chronic, which is long-term and can silently sort of damage the liver. What this virus does is that it inflames the liver, leading to scarring or cirrhosis, which sometimes leads to liver cancer as well. Many people with Hep B feel nothing for years, like this is like a quiet storm sort of building under a calm sky. So main modern treatments are antiviral drugs, that is to stop the virus from multiplying and reducing the liver damage, as well as interferon therapy to help boost the immune system to fight the virus, and they also offer monitoring such as like regular blood tests for viral load or liver enzymes, and of course liver scans. So a little side note on interferon therapy. This is like calling the body's internal alarm system and tuning the volume way up. Normally, interferons are natural sort of proteins that our body produces when it detects viruses, certain cancers, or other threats. In interferon therapy, doctors give lab-made interferons to mimic this system. So the side effects can be minimal, like flu-like symptoms, mood and appetite changes, energy, low energy sort of, and more. But if it is long-term, it can cause major side effects like depression, anxiety, and in some cases suicidal thoughts, as well as, of course, autoimmune reactions like lupus or hypothyroidism, and more. And some people will experience irregular heartbeat, worsening of the existing heart issues, circulation issues, low blood pressure, reduction in platelets, reduction of white and red blood cells. So it can have also nervous system effects, as well as musculoskeletal sort of impacts. So make sure to thoroughly discuss the approach with your doctor and how long this is going to be used. On the orthomolecular medicine side of things, the approach focuses on optimal nutrients for cellular health. So often the doctor would suggest high doses of vitamin C, vitamin D3K2, zinc, selenium, and acetylcysteine or NAC, and of course, depending on the patient, the approach and the levels of the nutrients are going to change. So, for example, some patients may even get herbs such as milk thistle or licorice root or black seed and others that may be prescribed to them. So there have been clinical trials showing herbal formulas actually performing similar results to interferons. In the traditional medicine, liver is viewed as central to blood production and balance of humors. We have 4 humors in the body. There's blood, which is warm and moist. There is yellow bile, which is warm and dry. There's black bile, which is cold and dry. And there's phlegm, which is cold and moist. I can go into each one of these in a different clip. Hepatitis-like conditions are seen as hot inflammation of the liver or imbalance in yellow bile excess, basically. So treatment followed in this case would be cooling and soothing to the liver by using barley water, chicory, fennel, or cucumber, and alike, and avoiding heavy digestion load like fatty and spicy foods or alcohol, followed by rest and emotional calm, of course. So basically the approach is to improve the burden, to remove the burden from the liver and restore balance and let the body heal itself. Colloidal silver has been definitely a topic of many discussions and conversations when it comes to this particular ailment. As much of a believer as I am in this, I also feel in order for anything to work, first the liver needs to be at least somewhat cleansed and rested. Silver has been used in ages for preserving water and food, treating infections, wounds, eye infections, and internal infections. And what scientists have observed is that silver nanoparticles can actually damage bacterial cell walls, interfere with some viruses attaching to the walls, and disrupt viral replication mechanisms. Silver binds to proteins and genetic material and hence interferes with their function. Traditional systems, though, never framed disease as kill the virus directly. Instead, it aims at strengthening the body, not just for one ailment, but in general, so hence restoring the balance and reducing the liver burden so that the body regains control. For colloidal silver use, a concentration of 5 parts per million to 20 parts per million is the most commonly recommended range, and it would be 1 teaspoon 1 to 3 times a day. Acute protocol when targeting the infection would be in smaller doses but more frequently, like every 2 to 3 hours a day. Now, for chronic conditions, lower dose, longer duration, 1 teaspoon a day continued for weeks or longer, and often combined with light diet and hydration. I have to mention that I, in particular, have not had a patient with this condition to be healed through this specific method. I have only heard of it, so I don't have a first-hand experience, and some methods even suggest holding the liquid under the tongue for 30 to 60 seconds before swallowing for faster absorption into the bloodstream. Now, emotionally and metaphysically speaking, across all healing and treatment modalities, the liver is not just an organ. It is seen as the processor of life's experiences. It is also considered the seat of anger, frustration, resentment, old emotional wounds, unresolved conflicts, and suppressed expression. Like a river that sort of would flow, but now has been dammed, basically. A liver is kind of like an emotional alchemist. So when something lingers in the liver, the metaphor often becomes something in life is not being processed, released, or expressed. Hepatitis usually points to heated or irritated emotional field, not explosive anger outwardly, but quiet, contained long-term frustration. Because hepatitis B is transmitted through intimate biological exchange, some metaphysical systems sort of interpret this as a story of crossed boundaries, feeling invaded or unsafe at some level. This, of course, is symbolic, not literal or blame-based. In modern medicine, some researchers and clinicians suggest chronic stress, which affects immune system, inflammation and emotional suppression, and which can alter actually physiological responses over time. In general, imagine the liver as a great river delta. It's flowing, life moves, clears, and renews. When it's blocked or overheated, water stagnates and pressure builds. The liver is the kitchen of the body. It transforms food into blood and distributes nourishment everywhere. So if the input, which is food, is off, the output, which is blood and energy, is also off. Hence, the whole system is going to suffer. There is no separation between nutrition, organ health, and disease. It's all one flowing process. So I'm an old medicine kind of person. and value the experience and the millions of successful results from it over hundreds of decades quite a bit. So liver issues like inflammation or hepatitis-like conditions have always been described as excess heat, thick or impure blood, and overload of digestion. Translation: the liver is overworked, overheated, and clogged. A diet is meant to cool the liver and reduce internal heat, thin and cleanse, make blood lighter and easier to process, and give the liver less to struggle with and heal. Hepatitis B patients will need to follow a certain diet until the system is healed. This diet would include light, easy to digest foods like one ingredient, no spice, plain soups, stewed vegetables, soft foods and fluids. Fluids help wash and ease liver function, and barley water is the cornerstone of this kind of diet. In this kind of framework, diet is not secondary, it's the primary treatment. A lighter diet leads to less metabolic stress. Less fat and alcohol equals less liver strain. And hydration leads to better detox process. So the diet also includes stewed fruits like figs, prunes, quince, apples, and pears, and stewed vegetables like zucchini, pumpkin, squash, all soft varieties, spinach, Swiss chard, and carrots. And to do a proper diet, you would need to speak to someone who practices traditional medicine, as they will ask questions, a few at least, to find out where in the system heating or cooling is sort of required or is off. And based on that, based on what they call sort of temperament and how they read it, they will then suggest the proper fruits and vegetables alongside the how-to recipe. So it all depends on your individual body temperature, basically, digestion, energy pattern, sleep, conditions of your tongue, alongside some other symptoms. This matters because instead of generic cleanse, you will be offered one that is perfect for your temperament. Hope this has been helpful. My clips are available on Rumble, TikTok, and YouTube. Like and follow for more. Be the light.